Dr. Allana Coffee, and this is Bamboo and Tea with Dr. Coffee. I'm here with a special guest today, but before I introduce her, I want to talk about our setting. We are still being cautious with each other in terms of spacing. We are outside to make sure that we are socially and safely distanced. But with that, anything could happen. There could be chickens, cats, dogs, planes, cars, motorcycles. It's all going to happen. And I just want the viewer to hang in there with us because we're going to talk right through all of that ambient noise because it's also kind of like the reality of our situation. And so welcome to our backyard. Right now, this young person who I've just met maybe about 1.5 years ago, just before the pandemic shut us down, I had the opportunity to meet her in person. And I think this is maybe the 3rd time that we're actually meeting again in person in 2 years. I'd like to introduce to you Dr. Vilmarie Baez. There's that ambient noise I was talking about. Motorcyclers like to come up here, and I always wish them well. So here's us wishing them well. Okay, good. So Dr. Baez, I'd like to just call you Vilmarie because we share a middle name. And ever since I've seen your name on paper, I'm like, Vilmarie, I'm Allana Marie. How are you, Vilmarie? So can you talk about...
Yeah, so Vilmarie is actually kind of a family name in the sense that both my mother and grandmother's names were Vilma. And so my family's Puerto Rican, and for whatever reason, Puerto Ricans really like to have like merged names. And so I think there's also some biblical influence in there. But so that's how we arrived at Vilmarie.
Great. I love it. I love it. You know, I often talk about names because I think that is one of the ways that families sort of like almost transfer some of that legacy and some of that cultural legacy. And there's meaning even though we're not really sure. And so sometimes people go back and ask their parents, yeah, what were you thinking? And it just is a wonderful conversation. Yeah. So thank you for that. You are an assistant professor at Chaminade University, and Chaminade in the last year kind of stepped up to provide a doctorate program for psychology students here in the state of Hawaii. It's very important that we continue to produce psychology students, excellent psychology students. And Chaminade moved into that space, and you were like right at the beginning of that. How did you get involved? How did you even know?
So I have always wanted to teach. I love teaching. You know, when I was in graduate school, I started teaching as a teaching assistant, and then I was actually able to get an adjunct faculty position while I was in graduate school, but teaching at an undergraduate level. And I've always just really had a lot of fun with it. And so after I finished my postdoc, I was trying to figure out what to do with my life. And it just so happened that one night I was looking on a job website and it popped up, and I was like, I'm not sure that I'm fully qualified for this, but I'm going to go ahead and apply. And luckily they took a chance on interviewing me, and I've been there for a little over 1 year now.
Yes, yes. What I know of you, you're very excellent at what you do. So I'm certain that you are actually qualified for that position. You're very humble. That's not the only thing that you do. So you also are, in addition to being a teacher, you're actually a clinician as well. Yes. And this is the other way that we know each other, although I went to Chaminade for my master's, but we work together as affiliates at Honolulu Psychology Collective. So what do you do there?
So at the Honolulu Psychology Collective, I have a really small caseload because I am working full-time, but I felt it was important for me, especially as an early career psychologist, to make sure that I'm maintaining my kind of clinical muscles, so to speak. And so I have a small caseload. I try to really focus on working with individuals who have some sort of health concern. And that can really vary and look very different. But I also see a lot of general mental health, so anxieties, depressions, things like that. But yeah, that's what I've been doing there.
Would you talk a little bit more about the intersectionality in your mind between psychology and the medical profession? It's not something that people necessarily connect. I think that unfortunately we have a disconnect with mind and body, but it sounds like what you're doing, it's very holistic. Can you talk more about that?
Yeah, so I can start by sharing a little bit about my training, because I think that helps kind of paint a little bit of a picture. So health psychology is kind of a big umbrella term, and underneath that there's a lot of different ways to practice health psychology, a lot of different specialties. My training is specifically within integrated healthcare, and essentially what that means is it's providing us the opportunity to work alongside other healthcare providers. So that can be physicians, nurses, pharmacists, physical therapy, occupational therapy, anybody who's contributing to a person's treatment plan overall. And so what I really believe is that psychology shouldn't necessarily always just be its own separate thing. I think that we can serve a huge purpose and have a lot of value in a larger medical setting, collaborating with other providers to make sure that we're providing clients and patients with the most holistic wraparound care. And so ultimately what that kind of leaves me with is really having to be thoughtful about taking into consideration some more typical behavioral health things like the anxieties, like the depressions, but really also considering how does that impact something like having diabetes, having a cancer diagnosis, having just had a heart attack and having to make a bunch of lifestyle changes now. And so I'm really invested in helping people live a healthier life, and sometimes we have to look at things other than just mental health in order to do that.
Beautiful, really. I mean, so part of these talks, really, it's about making what you just said available to people. So I'm hoping that the listeners will hear that and something in there will loosen and they'll be like, oh my gosh, she's speaking right at me, because I also have these concerns, and maybe not myself, but an auntie or an uncle or grandparent, because we're all going to have medical issues, right? And that we're invited to also invited to consider our psychology and our emotions in that context. So thank you for that. It's super important. And I'm so glad that you came to work with us at HBC, because that expertise is valuable. So thank you.
Of course.
Okay, another way we know each other is DESC, and that's the Diversity and Equity Steering Committee with the Hawaii Psychological Association. So thank you for joining that as well. What was your reasoning for joining DESC?
So I know actually you really encouraged me to, and I think I think a huge piece of it is because of some of both professional and personal experiences that I have. So I think for me, what's interesting is that I have worked in a lot of different geographical locations. So I've worked everywhere from Middle Georgia to El Paso, Texas, to now Hawaii. And so I've really had the opportunity to work with a really wide range of clients and patients. I've done therapy in Spanish, which is very different. And so I've really had to be thoughtful about diversity and really thoughtful about thinking about what I need to do as a clinician to maintain my cultural competence. That being said, I also consider myself to be of multiple minority statuses, oftentimes which are invisible, which kind of creates a really interesting experience both in my personal life and my professional life. And so it's something that I think is really important for people like me, people who look like me, to talk about. That being said, I'm also really invested in helping create awareness around health concerns, primarily with individuals who identify as LGBTQ+. And so I actually had the opportunity to do my postdoctoral residency at the VA, where I had the LGBT health postdoc emphasis. And currently I'm also doing some research looking at sleep quality in individuals who identify as sexual minorities. So that's a little bit of background as to why the DESC.
Thank you.
Yeah.
You know, this is Pride Month. We are interviewing in June. And I wonder about your work in the community. What should we be thinking? Like, what's going on? There's a lot of movement, a lot of talk. There's so much going on. It's hard to keep your finger on the pulse. So take us there. Like, what's current, what's present, and like, what should cis know and do and feel? Like, how do we honor and support?
Yeah. Honestly, I think it's just being open and being curious. I've actually been surprised that if you ask questions, you're going to learn a lot about people. You're going to learn that this binary that we're often kind of taught and that we have the expectation of societally is often not there, right? It's kind of artificial. And so it's really interesting if you approach people non-judgmentally with an open mind, out of curiosity, you're going to learn that there are a lot more people who identify as some sort of sexual minority or gender minority. And it's really just about asking, honestly, and not making assumptions. And then, of course, if you don't know something, admitting that. Admitting that you might not know everything, and that person that you're talking to might not need to be the person to educate you on it.
Right.
But maybe you can go out and learn a little bit more so that you can navigate that and be less hurtful in our language, because I actually think a lot of people say things not really realizing how it might come across. And it's not malicious, it's not something that is intentional. And at the same time, it can still be really hurtful. So I think we just all need to try to do better and be more thoughtful about the things that we say.
So true. And, I know that as an African-American female, people do have questions, maybe more now than ever. A lot of things have come up where people want to know. And so, I think they find me safe, and they're like, so what should we think about that? And sometimes I have, tolerance and bandwidth and patience and actually the information to give. Other times I do not. So, but you're correct about asking those questions. And I recognize that that's hard for people to do. They're afraid that they might ask it improperly or say the wrong thing even in the asking, but it's true. I also encourage people, find out, ask. If I can't talk about it today, I'll let you know that too. Right?
Yeah. And I think you bring up a good point, because one of the things that I actually like to preface, so I could walk into a room and be considered the expert on LGBT health, for example. And I always start all of my presentations saying, we're all learning together. And even myself coming here to help educate you, I might say some things wrong. I might make a mistake, and it's okay if you correct me. And so really just opening up that opportunity to speak candidly, make mistakes together, be compassionate towards one another when we do that. I think that's so important.
And that just applies to everything across the board. Like, it's whether it's about ethnic minorities, sexual minorities, or any other group. It's like, let's just know more about each other, and not so judgmentally, but more lovingly. Like, because we're better together. We, not going to get through the next, lifetime apart. We need each other. So thank you for that. Wow, that's so cool. We're going forward. What do you hope to do? What's next for you?
So what's interesting for me is that I have a partner who's in the military. And so in a lot of ways, our future is kind of up in the air in terms of, we know that we're going to ultimately end up having to leave Hawaii, which neither one of us want to do. But that being said, what I'm really focused on as far as, again, I mentioned I'm early career. As far as being an early career psychologist, I'm trying to make myself as well-rounded as possible. So I love teaching, I love research, I like doing clinical work, even though it's not my favorite thing, believe it or not, and not because I don't like working with patients. If anything, it's because I like it too much, so it's a little bit of an energy zap for me. And so that's why I like to make sure that I place boundaries around my clinical work so that I can be fully present and invested with anybody that I work with and provide the best care in every circumstance. But so that being said, I'm really focused on being as well-rounded as possible, so that if I move back to the States, the mainland, I can really kind of just have all the opportunities open to me. Of course, my main passion, as I was describing, is health psychology, and I am, I think, most of the time a people person, and I love working on a team with people. I love those interactions. As it has been for everybody during COVID, it's been difficult for me to be so removed, especially professionally. And so that's something that ultimately I really want to work towards, is hopefully work back towards working in a larger clinical setting, hopefully part of a treatment team that's contributing collaboratively to patient care.
That's that integrated health background that you have.
Yes.
You really like that.
Yeah.
I did a postdoc in integrated health.
yeah.
I loved it too.
Yeah.
I mean, you could just go next door and say, so what about da-da-da?
Yes, and that's so
yeah,
invaluable,
it's a great
both as
model.
a professional, but also for the patient, which obviously is the primary concern. So
This is why this person here has a wait list. It's hard to get an appointment to see Dr. Baez because you're charming and delightful and really take our profession seriously at the same time. Sometimes that's a hard balance to strike, but you've done a great job with it.
It is, yeah.
Really appreciate you lending us your expertise and really just your heart. It's really nice to be able to pick up the phone or email and ask you a question about something, and I appreciate you.
Yeah. Well, thank you. I appreciate you and, allowing me to come and work with HPC. It's been a great opportunity for me, and it's been a great avenue to, work in the community. So,
girl, we were stalking you. It's like, is she coming? Is she coming? So glad that you chose us. There's so much we could talk about. Like, I'm so, interested, like you worked with so many populations, and maybe we'll just have to do a second interview,
I'm open to that.
It's just plenty. And, as things come up too. So really, thanks for making the trek all the way up the mountain.
Absolutely.
And this is Dr. Baez, everyone. And I'm Allana Coffee with the Dusk interview series and also Bamboo and Tea with Dr. Allana Coffee. Thank you, viewers, for watching us. If you want to know more, there'll be links at the bottom, and you can just get our information from email or internet. So thanks. Have a peaceful and safe day. And we are better together. So thank you.
Yes, absolutely.